Page 2 now, the president's annual. President Trump has completed his annual physical exam, this after joking about its potential outcome.
Thank you very much, everybody.
How do you think the physical will go tomorrow? How do you think the physical will go tomorrow?
I think it's going to go very well. I'll be very surprised if it doesn't.
Mr. President, why did you backtrack on your notes?
You never stay on It better go well, otherwise the stock market will not be happy.
He'll put out a brief statement, but we'll take the weekend to compile the rest of the results, lab results, things like that, and he'll join me here on Tuesday to give a detailed readout of the president's exam and then answer a few questions.
Now, he who Sarah Sanders is referring is Dr. Ronnie Jackson, the president's physician. Dr. Jackson is a rear admiral in the Navy who practices at Walter Reed National Military Medical Center. Okay, so what do we know about the exam and its public record of Donald Trump, and what can we glean from what we know about the president's physical health? Joining me now from New York City, family care physician and Obamacare expert, Dr. Jonathan Vitale. Doc, I don't know if you could hear it at the end there when they were talking to the president prior to the exam. And he said, hey, things better go well or the stock market is going to drop. So I think he's a pretty confident guy. He was very confident on the campaign trail. Remember, he said that the doctor reported that when he examined him that he was the most fit for office in the history of the race of the presidency. We do know this, that in general, at his age especially, he's in pretty good health. He's 6'3", around 235. People look at him and they say, oh, he may be obese, but 6'3", 235 in that neighborhood, more or less, that wouldn't be in the obese range, would it?
Well, first of all, thanks for having me, Graham. Yeah, I mean, the information that we know about Donald Trump, which is mostly from basically what Donald Trump has said himself and also the reports that were released by his old doctor, which was Dr. Bornstein, show that Donald Trump is teetering on obesity. So his body mass index isn't yet 30, which would indicate obesity, but it's between 29 and 30. So by those reports, he is indeed at least in the overweight category. But no, he's not. By those results, he's not technically obese yet.
All right. So he can work on his weight.
The thing is, though...
Go ahead.
Yes. The thing is, though, Graham, from the reports that we know, and keep in mind that President Trump has doctor-patient confidentiality. So we only know what he has signed off on being okay for us to know as the American public. But what we know about him, other than his height and weight, we know that he takes a cholesterol medicine. So in the past, he's had elevated cholesterol. We also know he has rosacea, which is a skin condition for which he takes a medicine, an antibiotic for. And we also know that he takes a medicine called finasteride to help prevent hair loss. So that's essentially what we know about him in terms of his medical history. Now, in terms of what Donald Trump has told us many times, we know he has a very bad diet. We know that he doesn't really get any regular exercise.
Okay. Let's back up a little minute first. Let's go back to the weight. I think I heard in passing some soundbite one of the crew was working on today. He said at the end of an interview, you're never going to see me on a bicycle. It really would, I don't know if Donald Trump works out or not, but obviously there's a gym, I know that, in the basement, I think, of the White House.
Yes.
To lose weight, obviously, is two factors in general. Some of it's, of course, hereditary, but working out and diet. And as you just mentioned, the president has a unique diet. I don't know what it's like in the White House, but reading Corey Lewandowski's book on the campaign trail, that 757 Trump Force One always had to have McDonald's on board. That and Vienna sausage.
That's right.
That's not exactly a great diet, is it?
Yeah, I mean, he eats a very bad diet, which he is admitted to, and he's admitted when he did the physical exam, or quote-unquote physical exam with Dr. Oz during the campaign, he admitted that he needed to lose weight. He said he needs to lose a few pounds, but that it's difficult with his lifestyle. That's true, Graham. I mean, he lives in the White House. He has the best chefs, some of the best chefs in the world who would be able to make him healthy cuisine that tastes good. Yeah, maybe which is what I would suggest.
Well, maybe he went over to Baltimore and hired a couple of chefs from McDonald's. You know, they may be working in the kitchen now. I don't know. You mentioned cholesterol, and he takes cholesterol medication. Obviously, You know,
Yes.
those McDonald's burgers could be contributing to a cholesterol problem.
Yes, they
could.
can.
Probably
Yeah.
are. Okay, so the
Yes.
cholesterol medication, rosacea, okay, that's a skin condition. We're not really worried about that, I don't
Yes.
think. Hair loss,
Yes.
it happens to men in general over the age of 40 or 50.
Yes.
Not terribly worried about that. He's got great hair. But the cholesterol, is that something to be concerned about? And can that be mitigated with this medication?
Yeah, I mean, Graham, for a gentleman that's 71 years old who is at least overweight, you're always concerned about heart disease. So Donald Trump is on a statin medicine, which is a medicine to help control your cholesterol, which by our most recent results of his cholesterol test show that it's been working. So I think that's a good medicine for him to be on. There's also some indication, there was a report from his doctor as well, that he takes a baby aspirin to help prevent heart disease, specifically stroke and heart attack. So those are good things that he's on. Those medicines that he takes are fine, the statin and the baby aspirin. As far as I know, of course, I have not examined him and he's not my patient, but we only know what we hear from his physicians, which is vetted by Donald Trump.
And would you ever try and evaluate the President of the United States or any patient via television only? Would you ever try and do something like that, doctor?
No.
All right.
No. I mean, there are certain...
The reason I asked,
the reason I asked,
you can explain, but the reason I ask, you have this quack psychiatrist out of Yale, and I truly believe she is a quack. This is Dr. Brandy X, and she's not a doctor, by the way. She's a PhD. I firmly believe there's a difference. She helped edit a book called The Dangerous Case of Donald Trump. She's a professor at Yale, a clinical psychiatrist, and she's essentially diagnosing Donald Trump by watching him on television. Heaven forbid she's diagnosing me by watching me on television on a daily basis. I don't want to hear it. But the bottom line is, this can't be anything close to ethical, can it?
No, it's not. I mean, for the record, so far as I know, Dr. Lee is an MD. She is a psychiatrist.
Okay,
She's a physician.
All right. Okay.
Right. But it is not ethical, legal, or moral to diagnose or comment on somebody's psychological health unless you personally examined him or her. Now, this is a rule that the American Psychiatric Association stands by even today.
Right.
It's called the
Goldwater rule. Yeah, and we have that canon.
That's right. Back in '73.
And it's an important canon, right?
Yes, it's extremely important because otherwise, not only does it lead to hysteria and things like that, but also you have to remember, Graham, that patient-doctor confidentiality is one of the most important parts of diagnosing a patient. So even if you were able to diagnose Donald Trump just by watching him on TV and reading his books and his tweets, you would not break HIPAA laws and say what that diagnosis is publicly. That would be unethical and amoral.
I think
so. All of these mental health professionals should not be doing this.
I think that
should not be making these diagnoses.
I think
publicly.
she needs to be decertified from her being able to practice. I think her credentials need to be revoked. I think Yale needs to fire this person. And I think the president is pretty healthy, both physically and mentally, despite, Mickey D's once in a while. Doctor, thank you. Coming up next, the Democrat response to tax reform is all gloom and doom as the Daily Ledger continues.